Welcome back to News Channel 3 and our Health Matters segment this morning. A research center right here in West Michigan is working to make sure treatments and therapies are safe for patients. Director of Beyer Research, Wright Pelletier, is joining us this morning to tell us all about it. Good morning to you. Thank you for coming in.
Good morning, Jessica. Thank you for having me.
Absolutely. So Beyer Research, tell us what you guys are all about.
Well, I'll first tell you where we're located. Beyer Research is located in the lower level of Dr. Roger Beyer's private practice, just west of the WMU campus on Stadium Drive here in Kalamazoo. What we focus on at Beyer Research is to help pharmaceutical companies from around the world determine whether experimental therapies or new ways of using current therapies or those currently used or approved by the FDA are safe and effective by conducting clinical research trials in a controlled environment.
So it sounds like the latest technologies then. What kind of clinical trials are you guys experimenting on?
Well, at its inception, Beyer Research was dedicated solely on the focus of women's health. However, over the last 10 years, in addition to our studies for menopause, birth control, and sexual dysfunction in females, we also have trials for men and women alike. For example, we have hypertension trials, overactive bladder trials, and trials for irritable bowel syndrome.
So a wide variety then. Can anyone volunteer?
Well, there are strict guidelines for participating in clinical research. We need to look at a large various group of factors, and so some of those are age, we look at gender, we look at the age of the current disease that we're studying, and the length of time the patient's had it. We also need to look at a patient's medical history and any clinical treatments they may have been taking for that therapy, because we want to know up front, were those prior therapies effective, were they non-effective, or did that patient experience any type of side effects? And that's our primary principle for clinical research. We need to keep that patient safe, and we need to produce accurate results.
I'm sure all those factors you just mentioned play into that research, but you also brought up a controlled environment. What does that mean exactly?
And that goes back to that criteria. Again, we really focus on what we call a clinical protocol. We are guided by a protocol that the FDA has approved, and we can only include a certain subset of patients in every trial.
So why would someone be interested in maybe participating as a volunteer?
If you ask our patients why they volunteer, so many of them come back and say, I've done it because I really want to help other people. I want to contribute in some way. But that's not the only reason. Some patients have exhausted all current treatment therapies. And so being in a trial gives them that chance to have exposure to medications that aren't already approved.
So they can test it out before it's even on the market.
Exactly.
And it could have positive results.
Sometimes, absolutely. And that's one of the things. We can never guarantee that you'll benefit from being in a clinical trial, but we certainly hope so.
Okay, my last question, does it cost anyone anything to volunteer?
Absolutely not. All of the office visits and any diagnostic testing involved in clinical research is covered by the pharmaceutical company.
All right, some interesting information there. Who knew that you guys were located right here in West Michigan, right up the road from our station? If you want to learn more about Beyer Research, you have all the information right there on your screen. Thank you so much for joining us this morning.
Thank you.
All right.